Did you know that acute respiratory distress syndrome, or ARDS as we call it, is a life-threatening emergency which can be prevented by timely intervention? I am Dr. Vivek Nangia, Chief of Pulmonology for Cluster 1 Max Healthcare and also the Vice Chairman of the Institute of Respiratory, Critical Care and Sleep Disorders at Max Hospital's Saket complex. Respiratory distress, as the name suggests, implies difficulty in breathing. This basically occurs because of an inflammation in the lungs that gets triggered off by something as simple as a viral infection, a bacterial infection, tubercular, fungal infection, even sometimes exposure to chemicals can result in this inflammatory cascade. It makes a patient difficult to breathe. The oxygen level start to fall. Patients usually come to the emergency feeling breathless, feeling choked, not getting enough oxygen. Some of them even develop blueness in the peripheries and the nails, and this is called cyanosis. The diagnosis of ARDS is reached based on the clinical presentation, low oxygen state, and an X-ray which usually would show involvement of both the lungs extensively. The management would rely basically on treating the primary cause. So you identify the cause by getting some investigations done and then treat it accordingly. There are certain new drugs also available now which can intervene this cascade of inflammation. Apart from that, patient is provided oxygen. The oxygen may be with the help of just nasal cannula, a non-rebreathing mask, or a BiPAP, or now we have newer devices which are called the high flow nasal cannula. And of course, mechanical ventilation is the last option that one would resort to. And if despite mechanical ventilation somebody is not improving, then we have the latest technology which is called ECMO, the extracorporeal membrane oxygenation, that can also be used for such patients. Like you do dialysis when the kidneys are not functioning, ECMO is also something similar. It's the dialysis for the lungs. All this can be easily prevented by one, timely treatment of the infection which triggered off this cascade, and two, by avoiding smoking, three, getting your vaccinations for influenza and pneumococcal in time. So friends, to sum it all up, ARDS is a life-threatening condition which must be managed immediately and timely.